Hello, my name is Curtis Crane of the Crane Center for Transgender Surgery. I'm both a board-certified plastic surgeon and a fellowship-trained reconstructive urologist. Today I'm here to talk with you about orchiectomy. Orchiectomy is removal of the testicles. Reasons why a patient may want that would be if they want to decrease their estrogen dose or stop spironolactone, or if they have some contraindications, some health reasons why they can't take estrogen. And so they want to lower the dose. Or if they want to proceed with some kind of gender confirming surgery, but that they don't have insurance approval or enough money to pay for vaginoplasty. I often get asked, is it okay to get vaginoplasty after orchiectomy? And the answer is definitely yes. We do that quite commonly. So orchiectomy is a sterilizing procedure. When the testicles are removed, that's what makes both testosterone and sperm. That ability is gone. Although we have some patients that don't believe in a binary categorization of gender, unfortunately your body needs you to be binary, meaning you do need either testosterone or estrogen. You have to sort of choose one. If someone doesn't have testosterone or estrogen, then they can get fatigued, get osteoporosis, have anhedonia, which is just like a lack of happiness in life. Their sexual libido plummets. So there's a lot of side effects. Picture sort of a male or female menopause. There's actually a menopause in both sexes, and those are the symptoms of having low sex hormone, be it estrogen or testosterone. The reason why I mention both is because we have some patients that are not transitioning from male to female, but they want an orchiectomy for one reason or another. We can do this. However, the point of this whole part of the video is they do need to get on testosterone replacement or estrogen replacement, albeit if you're fully transitioning from male to female, as I mentioned earlier, your estrogen replacement will go down after you have an orchiectomy. Moving on to the surgery, we make one small incision in the scrotum, remove both testicles, sew everything back up, and that's it. The surgery can be performed under local in the office. If you have insurance that's covering this, then most patients choose to be put to sleep. But if you're a cash pay patient and you want to avoid the anesthesia and facility fees, then definitely getting it done in the office under local is less expensive. I ask patients to be extremely lazy, lazier than possibly you've ever been after doing orchiectomy. The biggest risk of orchiectomy is post-operative bleeding. The way this could happen is if we perform the surgery, you're relaxed, you're not feeling anything, your blood pressure is maybe 130/80, but then after 2 days at home, you're feeling pretty good, the pain meds are working, and you decide to go play golf or go running. When you exercise, your blood pressure shoots up to maybe 160 or 170/90 or 100. Then something that wasn't bleeding at a low blood pressure can then re-bleed. If this happens, all is not lost, but it will just prolong your recovery. So be extremely lazy for, I would say, 3 to 5 days. No heavy lifting greater than 20 pounds for 2 weeks. And most patients have this surgery on a Friday. If you have a desk job, it's okay to return to work at the beginning of the following week. But if you need more time off, we're happy to write a note for you. If you have a job where there's a lot of manual labor, then you should probably look at taking closer to 3 weeks off. And of course, we're happy to write a note for that. The risks of the surgery include infection, bleeding, wound healing complications, hematoma, that's blood building up inside. Sterility, 100% of patients are sterile after orchiectomy. Some patients bank sperm beforehand if you want your own children or more children. I believe that's all the complications: infection, bleeding, wound healing complications, sterility. All those risks are, besides sterility, which is 100%, are 1 to 2%. I've never had to transfuse anyone blood. I've never had to take anyone back to the operating room after orchiectomy. And I've never had to admit anyone for IV antibiotics. As always, we're available for any questions or concerns you may have. Thank you.